Chapter 16, Nutritional Aspects of Pregnancy and Breastfeeding, Screencast 4. Now, this screencast will be focusing on maternal pre-pregnancy weight. We'll be looking at issues such as overweight and underweight. So first, let's talk about babies that are born to obese women. And here, there's going to be an increased risk of birth defects. This could include an issue with oral collapse or neural tube defects, being stillborn or dying within the first few weeks after birth, having higher birth weights, and potentially predict being obese later in childhood. Women that are pregnant and obese may have high blood pressure, they may get gestational diabetes, and they may actually need to deliver through C-section. Now, we also have to take a look into account those women that are underweight. And these babies have an increased risk of a low birth weight, being born prematurely, and having lower nutrient stores. Now, one thing that we do know, many women suffering from these conditions that are underweight and obese may have difficulty becoming pregnant. Now, this table is looking at a couple of things, and what are some factors or maternal factors that will increase the risk of either nutrient deficiencies or poor outcomes of the pregnancy. So the first thing is going to be body weight. So pre-pregnancy, a BMI less than 19.8 or greater than 26. During pregnancy, inadequate or excessive weight gain, or an inappropriate pattern of weight gain. And we'll be taking a look at that a little bit later. If we look at age, a young age definitely poses an increased risk of nutrient deficiencies. If we look at eating patterns, so this is going to be important. If you have abnormal eating patterns or issues and things like that, that's definitely going to have an impact on nutrient deficiencies. Examples would be omission of foods from one or more major food group, vegans in particular, that may potentially experience not getting enough some of the B complex vitamins or protein. Those that are excessive consumption of a single type of food, because remember, variety is important, so that can result in some nutrient deficiencies, fasting and weight loss. There are also special diets to control the health conditions of a mother, such as heart disease, kidney disease, and so on. Some women may have eating disorders, and that definitely is going to have an impact in increasing the risk of nutrient deficiencies. Food cravings, aversions, we kind of talked about those a little earlier. Now, health is going to be a really important factor. Pregnancy spaced less than 12 to 18 months apart may increase nutrient deficiencies more than previous pregnancies if under the age of 20, more than 4 if over the age of 20. Carrying more than one fetus, inadequate prenatal health care, certain diseases, specifically HIV, AIDS, and diabetes, the onset of gestational diabetes mellitus, and that is something that happens to some women. Other health conditions that might be an issue are pregnancy-induced hypertension, preeclampsia, and or eclampsia. Now, that's not all, because there's going to be some other things such as social cultural factors. If we look at those individuals that have low income, limited educational opportunities, and those women that lack family or social support. Now, there are some issues with regards to safety of food supply. So things that could be an issue are food contaminants, so mercury, lead, pesticides, and also foodborne illness pathogens, so various types of bacteria and viral infections that you might get through the diet itself. And of course, there's some important lifestyle choices. These would include a high intake of caffeine, the use of alcohol, tobacco, drugs, or herbal and botanical products. Because once again, keep in mind, herbal and botanicals are not controlled by the FDA, and there may be some issues, especially related to pregnancy. Now, healthy weight gain is going to promote the optimal growth of the fetus, and it's also going to minimize a number of risks and complications, such as postpartum maternal weight retention and the infant's chances of developing chronic diseases. Now, below are some recommendations based on pre-pregnancy BMI. Women of normal pre-pregnancy BMI should expect to gain anywhere from 25 to 35 pounds. Women with a lower BMI, so less than 18.5, gain of 28 to 40 pounds. Women with BMIs of 29 to 29.9, weight gain of 15 to 25 pounds. And women with a BMI greater than 30, gaining 11 to 20 pounds. So notice the trend here. Women that had a greater BMI would expect to see less weight gain, whereas women either normal or underweight according to BMI would be expected to gain more weight. Here is kind of a breakdown of how that weight gain is actually distributed. If we look at full term, maternal fat stores increase about 4 to 8 pounds, uterus and breasts increasing by 6 pounds, a 4-pound increase in blood. And if we look at the fetus, placenta, amniotic fluid, 11 pounds, with the fetus actually weighing approximately 8 pounds. Now, here once again is an overall recommended weight gain. We kind of talked about this previously, so I'm not going to spend a lot of time here because we did address this. Now, there also should kind of be a pattern of maternal weight gain, and we're going to kind of break this down by trimester. During the first trimester, expect a gain of 1.1 to 4.4 pounds, and this is going to account for the enlarging breasts and uterus. After this, generally 0.8 to 1 pound per week for normal weight, 1 to 1.3 pounds per week if underweight, a half to 0.7 pounds per week if overweight, 0.4 to 0.6 pounds per week if obese. And remember, this is during the first trimester. During the second trimester, weight gain will be divided between mother and fetus. And during third trimester, the weight gain is actually all fetal in nature.